Awesome. So, welcome everyone. Welcome. I am I think just about everybody on this call know who I am. But just a reminder we do have a few people who are newer to our cohort. So, I am Latrina, and I am a program associate with Data Across Sectors for Health. And I have the honor and privilege to help Melissa manage and facilitate the KIC cohort. And so today, all of our conversations today are going to be about transforming connections in the community. So I just want to take a moment to say thank you all for taking the time to be here and to engage with one another. And so we decided to have this call because across the last couple of months, Melissa and I actually, we kept hearing the same concepts come up in very different ways across all of the projects. And we thought that based off of those conversations, this idea of community and how to make the work actionable was a trend across all of the projects. And so we thought it would be a great idea to partner with Dr. Meredith Shockley-Smith, who is our facilitator and speaker for today. And I'll just do like a quick, I read her quick, short bio for us, and I'm going to pass the mic to Meredith. So Dr. Meredith Shockley-Smith is a former professor of Black Studies and Women's and Gender Studies. She is currently directing the Queens Village work at Cradle Cincinnati, focused on lowering the infant mortality rate and boosting maternal health in Cincinnati. In addition, she is an assistant field professor at the University of Cincinnati Medical School. There she is taking her passion for Black studies and women and gender studies beyond the classroom in efforts to build stronger, more equitable relationships to benefit the greater community. She aims to engage fixed mindsets as they relate to cultural identities. Meredith received her PhD also from the University of Cincinnati in Educational Studies. As the Director of Diversity, Equity, Inclusion, and Community Strategies at Cradle Cincinnati in Queens Village, she seeks to work with Black women to co-create sustainable communities that help to reduce stress, in turn, lower infant mortality in Cincinnati communities. In just a second, I'll also drop in their website and their social media handles as well. So I want you all to join me in welcoming Dr. Meredith Shockley-Smith. The floor is yours.
Hey, thank you. The bios are always so weird. I'm like, oh, just Meredith. Anyway, it's a pleasure to be here. I am excited about it. I read some of your work, not as in depth as I would have wanted to, but you're doing great things, and I love to know and to watch all these great things happening all over the country. I'm going to start with like what I do and how I engage community, and I'm going to share a PowerPoint with that. I'm going to kind of run through it just to give you context on who I am and how I built community, and then I'll share deeper about what that looks like. And I'm about an all teach, all learn process. So I'm going to ask some questions and we can share with each other some opportunities and successes, because I'm all about hearing how it's working in your world. So let's start with what is Cradle Cincinnati and why did we come to be? So the New York Times in 2018 brought huge attention to, and I'm sure many of you know, and I'm not sharing because I did not share yet. Maybe I am. Awesome. Okay. That Black mothers and babies were dying at a really alarming rate. And so that was the first of many national outlets to talk about the extreme reality of that. And I can't flip my slide for some interesting reason. You might know how to do that. Boom. So infant mortality is when a baby is born, takes one breath or has one movement and dies before its first birthday. And in Hamilton County, where I live, we were the second highest county of infant mortality, like extremely excessive rate, which is 3 times, at that point, it was 3.5 times the rate of our white counterparts, all other races and ethnicities, which begged the question, why, like what is happening? And the major realities are they were born too early, or there were sleep-related deaths, rollovers, and smotherings. And the bigger concern was, even though we had these interventions around sleep-related deaths, around trying to keep babies inside mom for a longer period of time, we saw that lower significantly for the white population, but we had a huge disparity in Black babies dying. So we kept seeing this problem happen for Black women. So the crisis was that Black babies were dying, and our passion was around, can we just say the issue was racism, and then talk about that concept, which we know is polarizing, And so Cradle Cincinnati 3 years ago named that to their strat plan. We need to fix this problem for Black women. So when we think about partnerships, that's how we did it. So we reached out to every hospital system, we reached out to clinics and branding firms, and you name it. We're like, this is a problem. You don't want to see this problem. How do we fix it? And this was 8 years ago that you see these partners. Now this page would be, triple in logos. So to be clear, I am only holding the right side of the screen, which you can't see probably because the pictures are on it, which is the community part. But there are also many, many people happening in the Cradle Cincinnati space. So the medical providers are happening. We're doing conversations in the community around safe sleep, smoking, spacing. There's policy work, which is huge about sustainability. There's direct service. So how do I get mom a crib, et cetera. What we do is build community and put those people in conversation with each other so that they can co-create the intervention. So in 2018, we saw this huge high number. In 2013, we saw the huge high number. In 2018, we called Black women into the table and we said, you have the answers and we know that and we should be listening to you, not as in like, let's have a group of people we ask a survey to and then we are like, I'll take that under advisement, but I think I probably know better than you know. Or like, maybe I'll take a part of what you think we should do and add that to our agenda. And so instead of that, we went to listening and we chose to do that through equity, quality, and community through what we call asset-based community development, which I have an entirely different slide, so I won't get into that right now. But the notion of equity was the idea that when you bring the women to the table, they are experts. They should be paid and they should remain at the table. How does that happen? So when I came 3 years ago out of the academy and into Cradle Cincinnati, my goal was to hear Black women, see them, and build trust by doing what we asked them, what they asked of us. There were some challenges, we'll get to that for certain. But what they said was, I don't feel heard, I don't feel seen, I don't feel validated. I am isolated. And as you can imagine, quarantine was like unknowable on the already feeling of isolation, which happened before, this question asking happened before quarantine. And they were like, I feel stressed. Walking around in a Black body is stressful, and stress is really adding to losing babies early, so extreme preterm birth. So Queens Village was born. It was a scene that looked at creating a space because we asked them. By doing that, we went out into the community and created community advisory boards, which we'll get to and when we get to the ABCD piece. And we continually asked, what do you see? So we created Queens Village, and that was a space to be heard, seen, valued, lessen folks' isolation, and lessen their stress. And that was the short of it. Got together, ate bread in one community, and then it spread to other communities because those women became the marketing tool. They started to trust us, and we started to create empathy with the folks who needed to hear us, like doctors, et cetera. So if you are working in spaces where you're trying to create community, what does that look like? It's safety. It's creating that space for the folks you serve. So whoever it is, if we're listening to them and doing it, it looks like that. So how many folks we reached isn't really necessary for this conversation, but let's just say we got to 2,000 women. We have private spaces and social media, and part of that is about creating visibility because they didn't feel seen, right? So these are examples of how do you do what they say you're going to do, sometimes on a shoestring budget. Sometimes, like honestly, we don't all have dollars and cents. So it's like, if you want to be seen and we know people are looking at Facebook or they're looking at Instagram, then let's make that happen. So in 2019, those women saw 96 babies die, which was 20 fewer babies than the year before, which took us to our lowest infant mortality rate in Hamilton County, which was a huge change from the second highest county of infant mortality. So they were also feeling some celebration, right? I do have the power. There is power in putting the people you serve and using their expertise at the center of the work that you do. If we were standing together, I would do this activity, which is unnecessary for us right now. But last year during quarantine, really had to dig our heels in to really love on folks and make them feel seen and heard and valued, and for goodness sake, not isolated. So, that was sacred space on Zoom was like a whole lot of candles and a whole lot of prayers. But it did work out that we are now below the national average in Hamilton County. And that is the women that are doing the work, seeing the reflection of the work and the power they have when we center the folks who we serve. And so I'm going to get out of this and get into, first, I'm going to start with, are there questions? Is anybody like, is there anything about that you're like, I have a question? Or do you want to dig into ABCD first? Feel free to question. Yes, please.
Yeah, I'm curious to know, and I'm sorry I have a lot of feedback. I'm curious to know, in terms of interfacing with the practitioners, did you have challenges from a cultural or a bias standpoint? And also, did you include midwives or doulas or some other ways to bridge some of those issues for some of the people?
Great questions. Did we have bias or pushback? Is that the first question? Yes, indeed. So that's such a great question. When you talk about a polarizing topic, our first battle was to get buy-in on, it is certain that the women who are experiencing these outcomes are experts in their own reality. And our solution to that was driving with data. So we started with, what do they know? What other examples do we have of this working in other places? And I'll say that I'm happy to share with you later, like what research we did to say, it's working here, it's working here. And then there was just we like to give the example, the counter example. Why are you gathering all Black spaces was a big one. And so Black people are having a very specific lived experience. Would you go to for example, survivors of cancer support group if you weren't a survivor of cancer? Or why would you go to, I don't know, whatever it is, support group, if you're not having that experience? It's an invasive space. So trying to create a value system on why we gather that. The other piece of the work that we do that I didn't share in this, because I sort of did the short version, was that we do empathy circles and story sharing. And so we bring the opposite group or groups of people across lines of difference. So for us, it might be medical professionals, or it might be people with different identities. And we do empathy building. So I might ask a question around race, and then Natrina and I, for example, will be partners, and then she would tell me a story that she experienced, and I would tell her a story that I experienced. And we would come back to the circle, and I would tell Natrina's story. My name is Natrina, and I experienced X. And what that did when I first did it, first of all, I haven't seen a situation where folks aren't crying when that happens. It's the way you hold her story, right? I hear you, and I'm asking questions. And when I tell it, I feel like I have such, it's an honor to A, be able to tell it, and B, like to do it justice. So that's one of an example of how we build trust across lines of difference. And I will say too, that I have an advantage of being inside of Children's Hospital, where they have said, this is my diversity statement. So I also lean into that. This is what you say you're going to do. So let's hold each other accountable to our work, right? And so that's another one. Use the words of the leadership, of the funder, of the whoever to say, I'm just supporting you getting to where you're going. Does that answer both of your questions? Are there any other thoughts or questions around that work in particular? Or does it resonate?
Thank you, that was excellent. We really appreciate that. Are you familiar with the Black Women's Project out in California?
Yes.
And I put some other thing about Jenny Joseph, who's, you guys, this is so critical, this stuff you're doing. Thank you. And let's remember Serena.
Okay, and that is 100% certain. If you are a national, globally known athlete, and you can nearly die on the table, what does that mean for folks who have, no one knew my name before I walked through the door? It's really challenging. Also, yeah, San Francisco is doing wonderful work. Black Mamas Matter Alliance in Atlanta, which is another good thing. Who's doing your work in other places? How do you connect to them to get the opportunities and successes so you don't have to fall into those pit holes? That was our first look, like who are our exemplars and how do I reach out? Which is a great thing that you're doing here at DASH and this cohort in general is like, hey, what do I need to not do? What can I do differently? So if there's not any other questions on that, I'm gonna share ABCD. But before I do that, this is the process. My thinking on this is that we will look at community building and how do you dig into the community? How do you utilize your community? How do you keep them connected, build trust, add their voice, et cetera, in your own work? So I'm going to give a little bit on it, because maybe many of you know it. If you have talked about ABCD or use it in your work, will you drop that in the chat, yes or no? Just wondering how many people are using this or know of it. 2020, the question in the chat is what infant deaths were avoided? Preterm birth was lower. The extreme preterm birth, which is our biggest infant mortality driver, was lowered. And from data, we think that's around stress. So while people were stressed out in quarantine, they were at home. So they were doing a lot less running around. They were able to do their visits from telehealth, et cetera. So that data is not fully flushed out, but that's what we see as trending right now. So familiar, got a yes. So I won't dig deep because there's no no. If there's a no, shout out. So this is the model on which I stand because I love it, because it is very easy to see deficit. And I love deficit as well because it helps us to see the problem, right? We can't ignore the problem. So we talk about the problem and that is the deficit, but the people are the asset. So we, for the beginning of our work, I chose 10 people. And so if you have not yet, if you have a board or are interested in a board or engaging in community, my advice is to find 10 folks who will say yes to the work. I did that by students, Facebook friends, people in the movement, checking Facebook pages where you know people are doing work similar to your work. Some of the affinity groups on this page, I mean, they're everywhere. There's probably somebody you know, whatever church you go to, whatever community you live in, what are your assets? And then folks are like, we like to, see, to look at the deficit piece, understand the deficits, but then the problem with that is that we create policies and deficits that then perpetuate the deficit. So yes, there's truancy, right? Yes, there are gangs. Yes, there, are all of these things. But what do we want to be different, and how do we build policy? How do we build concepts around the positive? So here we go. Actually, sorry, give me pause for just 1 second. Thank you, there we go. So I'm gonna come back to this and start with the change in understanding the people you deal with. So most people aren't saying victims anymore, clients. We've gotten to advisor, we've gotten to advocate, but so how do we see our people as the producers of our work? We say that Queens Village is powering Cradle Cincinnati. We are doing the work you need us to do, folks who are losing babies at an alarming rate. You are the producers of our work. So in your work, I'm going to send you into groups because that's what I do in life. Maybe I am. Natrina, can you do that for me while I'm doing this? Or are you also a person?
Yeah, are you saying breakout groups?
Exactly.
Yes.
2 questions I want you to share with your teammates. The first one is, who are the producers that you're working with? Who are your community members? If there are none now, who could they be? Why are they on your team? What are their assets? And I'll put that in the chat, and I think you'll be able to see it even after you leave, right? If I can get back to the chat. So we're looking at the producers. Say it again.
Are you ready for the groups?
I am.
All right, sending to groups now.
And yes, I will make that bigger next time.
While we're waiting, Katrina, what a good session so far. It's been so great. Thank you.
Thanks, Trevor. Can you hear me?
Yeah.
You know, one thing I totally did not do was tell folks to record their breakout sessions.
Oh. What can you do? Maybe they'd like some privacy, I'm not sure.
Yeah, that's a
Beanish,
great point.
hand up?
Hmm?
Is Beanish's hand up? Fine, never mind.
No, it's not.
I don't see it. Hi, Beanish.
Hi, Trina. It is going really well. Yeah, I was wondering if the breakout rooms were going to be recorded, or if there was a way to get kind of one of us in each of them. But I don't know if that's possible.
I could send you. Can I send you? I was gonna say I might be able to send you to a breakout room, but I can't because it says that you have not joined. So I can't move you around because you're not in one.
Yeah, I have a little block.
I guess to say also, like, I feel like the level of understanding we have of these folks' amazing work is quite high. It makes me happy. So, who knows? Sorry, I'll stop bothering you. I'm sure you have other things to do.
No, you're not bothering me. I am about to send a broadcast, which will actually be my first broadcast.
I don't even know what that is.
Oh. Yeah, what does that mean? Oh, nice.
Oh, did you get it?
Yeah, 1 minute remaining.
Congratulations. It looks very nice. I like the smile.
I feel like I overuse smiley faces.
I overuse exclamation point.
Me too.
I do that in text messages.
Yep. Well, I also do the millennial things of LOL or haha at the end of every sentence. Serious.
Yeah, but the exclamation points, like I totally do that. People are like, why are you yelling? I'm like, I'm not. Like, what are you talking about?
Yeah, I'm pretty sure people think I sound excited all the time, which is not always untrue.
Well, it's also like the exclamation point is like a well-known like gendered effect overall, right? Like maybe not for individuals, maybe so, but it always makes me wonder, like, but why then do I overuse them? Like what, like why is it so hard to stop? And you know, anyway.
Okay, I'm gonna bring everybody back, okay?
All right.
Yeah, I can't wait.
Welcome back, everybody.
How's it going, Katrina?
Oh, just peachy. I did my first broadcast today.
Nice. Well, it's going good.
I learned what broadcast was today.
Hey, Trevor.
Hi.
And Beanish. I got to know Rose a little bit in our breakout room.
Awesome. Wanted to make sure I gave everybody at least like 5 minutes to kind of get through those first 2 questions. And looks like everybody should be joining now.
We couldn't see the questions.
Yeah.
Oh, I think that's because she didn't drop them in the chat. She just went over them prior to going into the breakout sessions.
Oh, and I had to step away briefly. So I think I missed that.
I love your shirt. Beautiful color.
Thank you.
Yeah, we had a good conversation, Rose. It's all good. Team is working.
We did. So did everybody miss the question of like, who are your producers?
Some people didn't get in the group. Something missed the bus. They missed the whole bus.
Oh no. So
yeah. I had about 3 people who were out hanging out in balance with me. So we had some great conversations about being millennials.
Who should have been able to figure out the Zoom room?
That's true.
Who are your producers at work, and what are their assets? What are they bringing to the table? So we'll share out, well, maybe if Lisa's willing to share out what we talked about in our group. And if anybody else who made it to a group and had that conversation would like to share some of those things, that'd be awesome. Like, whoa, are you down? Or is that throwing you on the bus?
Did you want me to share again?
Yeah. There you go.
Okay, sure. Oh, yeah. Well, some of these is my group too. So yeah, we talked about, the community ambassadors and community organizations that we partner with. And, some of them are really amazing in terms of the relationships that they bring and the trust that they're able to have because we're associated with them and working together. And the assets are that we work together to build the survey process and the ongoing survey project that we're doing, and that we've proven our ability to follow through because the previous ones that we've done to sort of build on the things that come up. And we're excited about their potential to be spokespeople and to really speak in a human way. And we're going to really embrace this concept of building empathy through conversations across different worlds, and empower them to use the data to be able to speak and be well informed in speaking about their perspective on social determinants of health and health disparities and how it impacts communities of color.
Awesome. Did anybody else get to this conversation while they were in breakout groups? And how many? Is that a yes, Amy? Will you share what your group talked about?
Sure. I think we just all kind of talked about a wide variety of perspectives of individuals that we were working with and some of the pros and cons. So I talked about that we have a fantastic group of cross-sector individuals that are a part of our initiative, which is fantastic. But what we're lacking is the community voice. So that is something that we really need to focus on in moving forward, because that's a huge asset that we're missing out. I think another member in our group was talking about they had some really good community voice when it came to students, and then the students left, and so they had to do retraining and get a different kind of voice. And so just kind of talked about some of the pros and cons in trying to make sure you're reaching out to the assets to get the information that you need, but there's pros and cons.
That's so true. Thank you for sharing that. I hear Millie and Beth have a great story from Light on the Hill. Which one of you is going to share said story?
I don't know if it's it's a great story.
It's
a
great
guess.
story.
Yeah. So when many years ago, when we were first embracing ABCD, and we had the opportunity, our church was actually going out throughout our neighborhood, utilizing apartment complex community areas, parks and things to do like pop-up vacation Bible schools. So we just basically would show up with a bunch of teenagers and hula hoops and music and snacks and lemonade and, just Frisbees. And anyway, we just played. And so one of the places that we had done and shown up and started in relationship with through a little later in time, we continued to be in relationship with this apartment complex. And it was actually 2 apartment complexes that were side by side. And one of them was you had to be elderly, living on, it got subsidized rent because everyone was living on their Social Security check. And so, and then the apartment beside them was families. So we, upon talking to the apartment manager at the family apartment complex, we were, saying, hey, how's it going? Do you need anything? And they go, wow, we have so many children, and they just are like after school, they're just running crazy, and the parents aren't home from work yet. And we're so afraid somebody's going to get hurt, property's getting damaged, just they're unsupervised, and I don't know what to do about that. And so we were able to utilize the asset-based community development by partnering with the apartment complex next door that had all of these folks that really we just had to convince them and make them see all the assets they possess, because they didn't think they had assets, but we were like, wait, you shared with me that you love to cook and you have a passion for that. And look, I see on your porch, you've got all these beautiful plants. You obviously, are a gardener, and, just those kind of assets started coming to light. And we found folks at that apartment that love to read and do story time. And we found people that taught these children, we ended up partnering where we had these older folks that were providing these activities for the neighbor, the next door apartment complex kids, where we even had some kids that were learning how to play chess. And we had, just arts and crafts. And there was just a variety of activities that the kids could do. And the older, the more mature apartment complex residents loved it. It gave them joy and it purpose and brought, life to them. And it was a great thing for the families too, because these kids learned a lot and had a great time. And there was a little more supervision happening and less kids getting hurt and things getting broken. And
I love it. That is exactly how ABCD works. That you go out into the community, you sow into people what greatness they might not even know they have.
Right.
And cross over, and all of a sudden we're lifting everybody up.
And for us, it was really simple because we just showed up with snacks and supplies, and tried not to mess up anything and get in the way, so.
Then another advantage of that.
And let the grandmas and the grandpas be grandmas and grandpas to a new group of kids.
I love it. And I love too that both people I am now engaged in doing something, and that's a really big one. We have an elderly, generational conversation all the time. And it's always this sit at the seat of your elders and learn. And it's like a wealth of knowledge, like a library. It's a gift. So I find it very, very cool. And the other point that I want to make, if you are still in the process of finding community, and I'm thinking of Amy in this conversation, it's cheap.
Yeah.
Your lemonade, your snacks, and your hello, Frisbee, and what have you. And boom, people are coming to you.
Speaking of boom, we literally were showing up with the old boom box and putting music and blaring it out. And it's like the ice cream truck comes, they hear the music and they come out and they're like, what's going on? And so, the first day they're all kind of looking from afar, and the second day they're joining in. And by the third day, they're waiting on you when you drive up, and so.
Speaking of the ice cream truck, if you hear the ice cream truck, that's the perfect person, because they don't charge you and they come up, the music brings the people, and your messaging is there. Like this is the
absolutely.
joy of the.
There's you a partner. Yeah.
Yeah, exactly. So I'm going to go to what is it specifically, so you can think about this in your own space. I am going to make this
5
bigger
total.
by.
Thank you.
How am I going to do that? This is why Katrina said, let me move the slides.
There you go. From current slide.
Got it. Okay. So my big one I always go to if it's in the middle of the page is ask, ask, ask. So you go there with your general idea. It's like, how do I get to the people? And then you want to know who they are, what they do, and how they can support. And also each other, but how I can support you. So it's like, what are your skills? That's my first ask always. And then you get the answer that they just mentioned. I don't have any. And then you spend 2 more minutes and you're like, okay, so in that conversation, you just told me that you knit, you write poems, and you babysit kids.
Right.
Great. And then in this conversation, I'm like, you play basketball every Saturday at this court. And for me and infant mortality, you're like, well, what does that have to do with anything? And I'm like, well, you have a kid sitting right there and your wife picked you up and she's pregnant. And so here we are, full circle, but that requires you to be in a relationship and constantly listening. So it's less talking, more asking, and people want to be heard. That's the other thing, right? So the listening conversations is a big one, because we're usually telling you get there and you're like, well, I have this program I want to tell you about. And that's kind of not the messaging. It's more like, I do have this program, but more importantly, I think you're an asset with gifts and skills. I think the other thing that we forget is that in your asset building, if you think about in your community, and I'm only picking on Amy because she said she's in the space of trying to find community, And so I'm like, let's help. We can use you as a model. When you're done with this conversation, you'll be like, done, community built. So if we're thinking about asset mapping in a community, what are the relationships in the community, or not the relationships, the buildings in the community that are assets? So like, is there a church? Is there a community center? Is there, you know, obviously there's a school. But here are the things under the radar. Who's the grandma that is on the porch, right? Like all of the time, and she knows everybody. And you're like, you know, I'm looking for such and such or this or that. And she's like, oh, they live in 3 doors down. So really thinking about what the buildings are, who the people are, because both institutions and people are important when you're thinking about building community. Can we stop and ask, are you fine to be the example here, Amy? Or are you going to not be interested in this process? You're good. Okay. So what community are you in?
We are in Lynn, Iowa.
Can you drop it in the chat or tell me again? Can't hear you.
We're in Lynn County in Iowa.
Iowa. I know nothing about Iowa, so this is going to be fun. So your project is just in like 3 sentences.
So we are utilizing a platform to really trying to focus on achieving social determinants of health for our families. So we look at care coordination throughout very holistic, you know, all the components of the social determinants of health to help families move from crisis to thriving.
Love that. Are you doing that in a hospital system, or are you a small nonprofit? Like where are you housed?
We actually, it's all community based. So it was initiated by Lynn County Public Health, but in all reality, we have our hospital systems, federally health qualified centers, we have education, we have community based organizations, mental health, all really aspects. So we have like this wealth of information and expertise. I think for us, what we're continue to lack is the community voice, and how, as we work together, you know, what should we be hearing from them to know how we think, again, because we are so brilliant, that if we do this, we are going to help families move towards thriving. But I think we're missing a lot of concepts from their perspectives. And so again, if we really want to utilize this data to make decision making, are we utilizing the data in the correct way? Are we collecting the data in the correct way? Did we really hear the voice of the community to even know that our goals that we're trying to measure are the right goals? Are processes even close to what the processes should be to try and move in that direction? Does that make sense?
It does. And I'm going to use asset-based community development. I met 3 of you on this, 4 of you so far in conversation. But the perfect answer is on this call. We can say, Lisa, tell us how you got ambassadors. What did that look like?
Yeah, well, I was just thinking about this commentary, and you know, I bridge the worlds as a clinician, and also I teach courses on public health. And the biggest challenge is this whole thing of encouraging community and the good intentions of structures of health departments and federally qualified clinics, but the reality of the disconnects that happen between institutions and community perspective. So I think this empathy conversation that you're talking about, we did that too. And really, we did it around maternal morbidity and mortality issues. And what we ended up doing was we took the public health people, the health department, we took them through what a pregnant woman had to go through to get in the system to be verified as pregnant to become eligible for services. And they realized how discoordinated and disconnected it was, that was how we began to change, and because people will be willing to change. So using ambassadors to bring them in and involve them and really hear and listen, not just talk to them on what you think needs to happen, but to really find ways in church ministries. Now, Iowa, interestingly, Dr. Smith, my daughter used to have to go there. We actually drove to Iowa from Florida, a whole nother story, for care issues. And it's a very diverse world in Iowa because they really had very open arms, and they have this beautiful multicultural statue in the airport and everything. I think finding church communities, the many different ethnic communities, the social organizations, is a huge Ethiopian population. Some of the best Ethiopian food I ever had was in Iowa, of all places. To really engage and maybe even have events in their places You know, a lot of the problems is everyone wants people to come to the hospital, come to the clinic. People don't necessarily have time, and you know, and also you have to do things in the evening. You have to do things on the weekends that don't often work with people in structured work environments. You have to be a little more flexible in how you try to reach out and engage and hold that banner out, or find pastors, ministers who might be one of intermediaries. Is there an NAACP? Is there a branch of the National Medical Association? Are there any Black doctors or Latinx doctors there to help be those spokespeople to bridge those relationships? I would strongly encourage that, because that's how you have to intentionally work towards finding to bridge, you know, the important ways that you want to help these communities, but also there may be ways that they need to be helped. And I know part of why this data is so important for us is that the structured surveys through like the Florida Department of Health, the kind of questions that they asked weren't relevant to the issues that we saw. And when you look at the counties that we live in Florida, we look very good from a public health perspective overall. But when you drill down to the communities of color, it's a totally different story. So we need to value that data. And are we collecting that data? And are you showing that you're looking at race and ethnicity data as well? And what you want to do about that? So long answer to your question, but I want to share maybe some specific strategies.
Thank you. I would also add that CABs, which are called Community Advisory Boards, is a theoretical framework for how do you gather those people and hold them together, ask the right questions, listen appropriately, train them to go out and ask other people. I always appreciated the language, so that when I was selling it to others or selling it to a funder or letting other people hold those conversations, we did listening circles when we got onto the ground to see what people wanted, and just to make sure we had some integrity with our words. And the data collection, we did some CBPR, so community-based participatory research, training folks to be able to collect data is also another good one. I'll drop that in the chat as well. So is there anybody else on here who has an advisory board or who has ambassadors who would share how they got to that point? Like, what did you do? How did you find those folks? And how are you holding them in community?
You know, we founded the Community Health Action Team. That's what that was called. And most health departments have some kind of funding or some person that's health promotion. And we basically had one of these conversations, and we had a community health advisory council with the community first, explain why we need to have it with the health department. And then the health department provided the structure. We need somebody that could send out the emails, somebody that could keep the list, somebody that could have the agenda, bring in the speakers, et cetera, to keep it going. And then we have one of our community ambassadors is on the Community Health Action Team. And so then when they have their meetings, they share out what we're doing. So it works both ways.
Awesome. So let's get back to our own individual work and talk in groups one more time and answer these 3 questions, which I now put in the chat prior to. So copy paste in case you don't have it when you pop out. And Natrina, who is awesome and talented, is going to put us in breakout groups. Right? Maybe. Natrina, are you there?
I am here. I am about to open up all the rooms. Did you put, okay, I just wanted to make sure the questions were there.
I'm going to put it again so it doesn't run into the other CAB and CBPR. So I'll just say them out loud. So we're looking at what does it achieve? But I think the question that you focus on is who do you need to leverage to make that happen for you? So for me, I was like, I know that hospital systems in my area have them for certain departments. I know that the churches in my area have, Wednesday night, whatever. I know that the recreation centers in my neighborhood, the moms are picking up their children at X time, like it closes at 6. And if I stood out there for an hour, I could say, this is what I'm doing. Are you interested in working with us? So what can you leverage? What do you achieve? And we're joining.
Trevor, how did it go?
Beanish and I had such a good conversation.
You were in the room just with
It was
Beanish?
just Trevor and I in our group.
We talked about our prior work.
Oh, you know why? Because you all were out here with me the first time, and I put everybody back in the groups they were originally in.
That makes sense.
We should have just stayed so we could talk to you too.
There's a youth adult partnership rubric that I want to send to Beanish. That is really good.
That sounds pretty interesting.
Okay, normally I don't share out, but there was a share in my meeting that I think is also really important, which is you bring these people on as community advisors, as ambassadors, whatever your language is, and you bring them to the table. And you also bring them to the meeting. So when you're having a conversation about the work, they are in the conversation. So I was in a conversation with some folks who are on the ground doing the work, and I was like, this, my friends, is how it's done. Really important piece of asset-based community development is that you're not giving, it's not saving, you're bringing us into the work. We're all doing this together. So I love that. That was really cool. What else happened in other people's groups? Did you get anything? Did you gather anything? What could you leverage? What did you leverage? What are the benefits of leveraging? Thank you. Did you talk about anything?
I didn't go to a group, but I'm curious to hear from, I'm going to make people talk now, from Northampton and from SA 2020. Let's hear what you brought to the table. What happened in your conversations?
Yes, I was the last to speak, so I'll have SA 2020 go next after me. But I was saying that we work, at least our office, Hampshire Hope, and the drug addiction recovery team, do all of our work in a collaborative nature, working with police, EMS, first responders, hospitals, and recovery centers to collect substance use disorder data in aggregate reports, and then protecting the public health information so that it meets HIPAA compliance. So we don't do really anything without collaborating, and what we bring to the table is the database that we're expanding. So we reach out for help on our projects every day.
How do you do that?
How do we do the
collaboration? Yeah.
Well, it was started with a community compact IT grant from the Commonwealth for shared services across the Commonwealth to build the database, because there's no county governance structure in Western Massachusetts. So each municipality operates kind of on their own in the western part of the state. So the idea was that the Community Compact IT grant would allow municipalities to work together, in this instance for Hampshire County, to create a database, understanding that Hampshire County as a government entity itself doesn't have a, there isn't a county public health entity. So it's run by municipalities. So municipalities working together to create a database. And then now that's being expanded into the other 3 counties. Again, there's no county public health office. It's each of the municipalities of Western Mass.
So each of your connections are between
municipalities. Yeah,
Gotcha.
municipalities, because there's no county public health office. It was.
Where are you in what state?
Massachusetts. So this is the western part of Massachusetts. So there are county public health towards the Boston area, but there are no county public health.
Interesting. I see a county public health question in the chat, which we'll get to after the second person that Trina is volunteering to share.
I was voluntold. We're in, I'm with SA 2020. We're in San Antonio, Texas, and I'm looking at Melissa's note in the chat, because I think I shared with my group something to this extent in thinking about our assets and where we have to go outside. We're highly collaborative in San Antonio. We have been for like the last 10 years-ish. Like there's a disconnect for like local funders and like local family foundations in understanding systems related work and all of this great stuff that like we're doing right now by participating with DASH in this national cohort and having funding to do this pilot program. And we've received, you know, funding before from the Kresge Foundation to do this work. And it's interesting. So I'm like, we have all these great individuals in our community. We have all these great nonprofit organizations that we work with that, you know, kind of are our assets. It's hard for us to communicate what we do because we don't do direct service to individuals. So it's hard for us to make that case to local folks, but for some reason, national folks, national funders, and cohorts such as this understand it. So I see how our assets and working with them smarter and learning in a group like this to be better can further that. And I guess that's what we're here for, to like make that happen at some point. Yeah, that's what I shared with our group. And then thank you, Melissa, for posing this question, because, you know, it gets my brain going.
Totally. I love the the question in the chat about this partnership. Can you say more about that, Trevor? Is that a question or just a comment?
Oh, it's just a comment. I also engaged in the activity discussing some assets in the community. I am part of DASH. I actually read some of the journals. So this youth adult partnership rubric was really helpful at kind of identifying where our opportunities to grow in the way that we approach our relationships with youth as it relates to a CBPR project I was working on in a different life called Connect Protect, which is a community coalitions for HIV structural interventions.
Yes, I love that. So a public health department on this call. Question in the chat is, do you have the resources to do this work? Can you gather community advisory boards, ambassador programs? Do you already do it? I'd assume you don't.
So we actually are a public health. Well, it's a community initiative, but it was spearheaded by public health, and public health was the one when we initiated that actually did go out to the community and did a lot of community voice. I mean, they really went out to talk because they wanted to make sure that it was equity. I think the issue, I came a couple of years after they first started, is then that was it. So there was like a big push in the beginning to gather all this information and blah, blah, blah. So we're this equitable initiative. But then I was like, but I still feel we are not that community voice. Like you said, they have to be at the table. They have to be part of the meeting. So we're, you know, you can go to a grantor and say, look at all this equitable, great stuff we did. But in all reality, then it stopped. And I think that's the issue, is it can't stop. It has to keep going. They have to be a part of the continued growth and development of the work that you're doing. And so I'm continuing to push. I actually don't work for the public health department, but I continue to push to say, this is some of the stuff that we need to continue to evolve. One of the things that you guys were talking about was churches. That was my big push. I was like, we really need to get the churches involved. We have all this great sector, but we don't have churches involved. That's a big piece that I think we're missing, that perspective. So a lot of the stuff that you guys said today just continued to bring back for me, my need to continue to push this because of the importance, really.
When you think about the barriers, one of the barriers in the questions in the chat is funding, but what else? Like, is there a capacity? Is there like lack of value on it? Is there not somebody who has the equity mindset that can hold it, push back from the top? Like, what barriers?
For us, 100% funding is a huge issue. I can't tell you how many conversations I've had, the fact that people who sit around the table deserve to be paid to sit around the table, right? And so that's a huge one. And so the funding has just been really, really difficult. I think the other piece is just helping to educate around what all this data sharing and care coordination and coming together and cross-sector work really means, right? Because it means so many things on different levels. You have the individual level, you're trying to help people move, right? You have programmatic levels. Are there programs really working to move families? And you're going to have this data that kind of talks about, are we actually meeting domains and actually moving because of our program and our work? And then you have that systemic work, right? So helping them kind of understand all that and educating them and helping them see, yes, these data pieces are going to help us in this component, but this is going to help us here, and working together in this. It's a lot to try and educate people on. And then also help them see what your voice can do to strengthen it, right? Educating the fact that this voice could be a part of this big systemic world, I think is another piece that we are still, I think, struggling with.
Education. I hear that 100%. Sometimes there's a foundation that you can build on easily. If you get to people who have some general equity understanding, then I can build on that quickly. But if you're like, we don't have a problem, now we're back quite a distance.
Yeah.
So I do hear you. I think about the resources on that are, what are the commitments to your DEI messaging? Ask that question. Like, what are we doing differently? How are we driving it data differently? What is the impact on the data? So my big thing is, hello, the data. You cannot just allow this reality to be so. I see a hand.
Yeah, we have a saying, like faces in like places. So you have to have people that look like the people you're trying to deal with to help.
We've struggled with that in Iowa for forever.
Right.
You know, and I know we're not the only community, but I know we have just really, really struggled that here. And it has to keep continually coming from higher, and more people saying it and figuring out, again, more of a systemic work plan. And another, we've got a lot of work to do.
Yeah, and also intentional recruiting and intentional partnership. Because one of the things I was able to broker, which was really about a challenge on shared decision-making and sharing of power, was to do the HIV/AIDS outreach that we knew needed to happen, changing the way they trained people to become sort of just educators, and having it happen after hours on the weekend, breaking it up and not having like 2 full days, because people couldn't take off from work and go do something for 2 full days, but they would give up 4 hours in one evening and 4 hours on a Saturday. And then we had a cadre of incredibly powerful people. In fact, at one of the outreaches, they had like the health bus or whatever that was doing HIV testing. The health department people were sort of kind of grumbling that there were too many people coming for tests, because our outreach people were doing such a good job and were so on fire of getting people and driving them to come to the bus. And I was like, that's the kind of problem we want to have. Now, when you let them also do the tests, because they didn't feel comfortable with letting them do testing and managing confidential information. I said, these are people that have already been through the system. They know more than anyone how important this all is. And so once we were able to broker that and let them also do testing, sometimes it was out of the back of a car where the guy sells the CDs on Friday or whatever. We quintupled the number of people getting tested and screened, and therefore identified early enough to get them into care and keep them from hospitalization expenses and other things. So it's ultimately a win-win when we make those innovative changes.
That is the belief in the people.
That's right.
That is the shift in our reality. If you believe the people you are serving have the ability to make change, they will.
They really will. And virtual has made it so much better. We can help advise you. We're on Zoom, there's so many ways to bridge it now, because people are more comfortable with this kind of environment, to bring in what may not be available or to help find it.
Really thinking about COVID and quarantine, which we could all complain about, don't you worry, we have kids and whatever else. However, some of the wins that help us in this work is that most school districts wound up giving computers to all of their children and making sure the Wi-Fi worked in neighborhoods where it otherwise wasn't, believe you me, the year before. And so the reach for getting on calls and doing, whatever it is, asking the question or just checking on folks and see how they're doing, or how do I drop by and, figure out what you need, food, how can we run the school train and help tutor kids, because people were like, I have an 8th grader and they have a math question, like, what am I supposed to do with that? And I'm like, let's see who the math teacher is in your neighborhood. That's asset-based community development. You get on your Facebook private page and you drop in your concerns, and then folks feed themselves. And then that becomes a network that loses dependency, but creates realities of people doing for themselves, which is what they really want. At least they do in Cincinnati, was the question. I see questions in the chat. There are questions in the chat or just comments?
Mostly just comments. I'm just echoing and giving everybody my hallelujah hands because I'm just over here like, yes. I do have another statement that I did not put in the chat. I think we have, Juan is here from PRC, and they are also in Iowa. And I was just wondering if some of the concerns and challenges that Amy is bringing up, if that has become prominent in some of the work that's happening with the Prevention Research Center. Is Juan still on?
Yeah, I'm right here.
Hi.
Hi. Yeah, so, Amy, everything you've been saying about Iowa, that is a challenge that we face in Iowa City as well. So Lynn County is neighboring the county that Iowa City, for anyone that needs like a geo map. But I'd say that even within, working in the PRC and working with our collaborators, it can be a challenge to find folks who are willing to partner with the work that we try to do and lifting these voices. And I think that isn't just, I think that there are very much like legal and systematic, I guess, issues within Iowa and working with agriculture and food production. And I guess like the power that some of these organizations have to really just make it harder for folks to really either speak out or to seek help. And it creates this chilling effects to a variety of different services. And so everything you said, Amy, yeah, it's a challenge in Iowa City as well.
Thank you for sharing that. I have a problem with an asset. I locked my charger to my computer at home, so I'm coming in on my phone. So while we do this, I'm gonna try to share and it'll probably hang up on us, but anyway, let's move back a little bit to our PowerPoint and get to foundationally the 5 core principles, because I don't want to miss those in case you have not yet studied it. Got it. Recording in progress. Sorry, everyone. Just in case I lose you. And also you don't see my screen. Why is this not bigger? Okay, so there are 5 core assets. Am I echoing or are you guys okay?
We're okay. I'm not getting any feedback.
Okay, great. So when we think about assets, we're talking about individuals, which we already went over, and we have figured out that there are some folks on this call who are an asset and in the community. And then there are associations, informal groups. We talked about churches and clubs, and we reach far. So it's like, the golf club is useful. Perhaps there's deep pockets there. Perhaps there's somebody who wants to do an event or have a mentorship or what have you. What are the major institutions who have assets beyond measure, right? So these are, when we think about asset mapping in your community and finding your, I would say 10 folks, we are a community advisory board if you were using the CAB theory that we use as change in the asset-based community development work. These are your top 3 engagement pieces. Policy work, before we leave this slide, policy work is super important in that the sustainability of the work only happens if we create change from the deficit-based policies that are currently in place that are causing these deficits in our outcomes. And so really trying to align, thankfully shared data even, and I'm thinking of people who are doing work similar to what I'm doing, and you know, how do we share the work we're doing so that we can drive harder and faster at change? Those are also assets. I'm gonna unshare and reshare because it won't let me change pages for whatever reason. And our last two are physical assets, and I think I did go over that when I talked about what buildings and spaces and places are in your reality, but also like what are the parks, where are the kids hanging out, what are the basketball courts, where are the people at, what are the universities, researchers. I think I was on a call, one of the people on my call was like, I'm actually a statistician and I don't really reach to the community, and I was like, you're actually my favorite person. Because I'm the one who's all about going to the community and talking and getting down and thick things. And maybe I'm down to write a grant, do the reporting, you know, strategy on top level. And then I'm like, what does this say? Can you make that real pretty with a bow? So everybody has a role to play. And then I really appreciate the people who are not doing what I do or have a clue how to do. So that's awesome. But thinking about your physical assets, super important. And how do you share out what you know? So even if you're doing high level work, even if you're doing, you know, you're a statistician or what have you, how do I tell the people that I collected that data from what they need, what the information was that they gave me, how it's going to impact them and now and in the future, and be thankful. So we're in communication. For me, in the work of Queens Village, we stay in community with those people. And by those people, I don't mean just the advisory board, but for us at Queens are all Black women. So there are advisory board people who are being paid to do the work, but who are creating space to have a larger conversation, to have more voices at the table, to be more celebratory to all people. And it's a partnership for everybody. So we're working on infant mortality, but when somebody comes in, for example, to talk about HIV/AIDS, or if somebody comes in to talk about diabetes, we're already gathered. Is this something you want to talk about? Great. So the community piece isn't just about the 10 people you need to serve you, but rather about the community of people who are dealing with unlimited things. How do you message and utilize those folks in partnership and connection, which is our last piece, making connections between, for us, it's hospitals, departments, and it's also, you know, all of the social determinants of health. So transportation, housing, policy work, how do we get people to share their stories and create change in policy? And so this is the piece of connection. How do we support each other? I'm thinking about, like, when I get off this call, I will most assuredly call Lisa, like, tell me about this ambassador piece. That's connection. And I'm also gonna call Amy and say, you got your 10 people yet? So I will come to Iowa right now and find them. Maybe not right now. The ban for travel is over in July 15th. After that, we can find the ice cream truck and work it out. Are there other thoughts, questions, concerns about how asset-based community development can be supported in your work that we could all pull up yours as an example and brainstorm about possibilities or barriers? I see them coming on.
One of the things we did early on was to establish an interagency network. What we found was that each agency was kind of operating in their own little silo, and they didn't know what the other agency was doing or what the assets they had, what was the level of their service, all of those sorts of things. So what we did early on was to invite them into community, you know, come have lunch with us and let's talk and let's share what each of us do. And so from that, we became more organized. So we had a president and secretary and a communications person. And over the years, we developed a really nice core so that when we had an emergency situation, all we had to do was pick up the phone and say, okay, here's the situation. Who can help with this? And one example where the woman was released from prison, had nowhere to go, no resources. As you can well imagine, it's when people are released from drug rehabilitation or out of prison, and they are really put out in society with no safety net. They have nothing. So what we did, the call came to Light on the Hill, which is our organization, and we reached out because we did not have the facilities to, offer housing. So we reached out to another organization called Mercy Gate, and they said, yes, we'll take her, because they actually have what's called the Magdalene House. And they invited her in, and they helped her get a job and to get reestablished in society. And so we found having that kind of network is invaluable. And that's how you build kind of a core interconnected network of resources, so that when people have an issue or a problem, you know where to go.
Yep, absolutely. We call ours a hub. It's like, what do I need right now? Are we in relationship?
Thank you.
We're not in competition, just so we're clear.
Right,
right.
Absolutely.
Right.
We're all part of a team. That's really been helpful. And, it's those types of relationships that instead of sending folks that we're trying to help on a wild goose chase all over town when they're already stressed out, and maybe they have, this much gas in the tank, and, we just think, oh, go there, go there, go there. I mean, we've just created more stress for them. But when we can hand off, make those good handoffs to the folks that we know what they do, and then it really is a blessing to those folks. And we've had situations where it's a Sunday morning at 7:00, and I need to call the crisis center manager, intake counselor, to say, hey, I've got a situation that this lady needs help now. And they're like, okay, come on, bring her over. And if we didn't already have those relationships and going through the interagency networking, we couldn't have done things like that.
And one of the things that we did is we developed an interagency directory. So all the agencies are in there with contact information, with the level of service that is offered, any eligibility criteria that needs to be met. So that's been very helpful.
I also have Calissa, you have your hand up.
Yeah, I just wanted to build on what Light on the Hill had shared, because here in Monterey, we'd done something very similar. We have something called the Active Referral Network, and it meets monthly, where we have just different CBO partners, but just different partners working to share about new services or change of services, and just highlight programs. And from that is where we developed project is in relation to Dash, this referral network that is a platform that documents referrals between agencies, and it documents the outcomes, and then also how folks are improving or maybe not be improving in relation to the care that they receive. And so I think that that's really powerful, that even during the pandemic, we've increased attendance as well, and people find it really valuable. And we've been able to also increase just utility of those meetings with the smart referral software as well. And I think just kind of bridging on what Amy shared, I think we have a really great participation and understanding of the assets and eligibility and all of those components due to the meetings and the software. But I think that we're still finding ways to involve the beneficiary voice in that process. Because even though I know our partners will bring example experiences that they've had with the beneficiary, so the folks that are having the referrals made for them in the software, it's still, I think, been difficult to get that end user feedback in terms of the residents who are receiving referrals through the software. So that's something that I think I have a couple of ideas from this meeting, but is something we're really thinking through.
That's awesome. That software is awesome. The database idea. We've tried several different ways. Our issue is trying to get it to be user friendly. It's like, oh, it's an Excel spreadsheet and I don't know what to do. So this software notion, I'd love to hear more about it. Will you drop the name of it in the chat?
Yeah, I'll put the link to our website where there's a little bit more information about it too.
Yeah, I'm happy to share ours as well.
That would be great. We have so much information to share and we do not have software to do so. Excel is not working out, so I'm excited to hear about that. I want to, before, I know we have 6 minutes left, are there other thoughts? What I want to say before I get done, before we end, I'd like to take some serious time to say that these are the kinds of calls that give me life, that make me think about what's happening across the nation and who are doing great work and who have ideas and thoughts. And I am always available, and I'm putting my email in the chat. If you're like, I have a great idea, or I heard something that you said and I, think you could build it on this way, or have a question, or would love for you to think with me on this. I am here for the collaboration, because the more we work together and the less pit holes we fall in, and we move faster towards our success goals. So I just want to offer that to you. And if you are also willing to do that, email me. You don't have to put it in the chat, or you can private chat me if you are down. If you're like, I would like some support, I'd love to share. Happily continue this conversation. But I wasn't cutting this off because we do have 5 minutes. So are there other thoughts, questions? Here is our website, blackwomenforthewin.com. If you want the wonky version with all of the research and data and all the things, I work for Cradle Cincinnati, and Queens Village is under that. So there's cradlecincinnati.org. The community work is all under Black Women for the Win. And the allyship work is happening there. How do I show up if I'm not a Black woman, which I think is also an important conversation. And people are always like, what does this mean? Like, I'm in this work, but I don't look like you. And I hear you saying I should, and I don't know what that means. So how do I show up? And we're like, oh, we got answers for you. We don't have time on this call, but we could do another call on allyship. Amen. You're here.
I would love that call, by the way. I'd be the first to sign up. Saying.
Let's do it. You could also just call me. I'm also down for the call. Actually, we have an allyship thing coming up. I can send it to Natrina to share.
Awesome. I could totally get that out to the cohort. As everybody is dropping off the call, I also want to make sure that I just want to remind everyone that Dr. Meredith shared with us 2 articles for you all to reference as resources. So take a look at those, check out the website. There are a bunch of different references that you all can utilize in your work. And I also want to continue to encourage all of you to connect with each other. I'm seeing like a lot of braves throughout these conversations. For instance, Juan and Amy, with you being in Iowa and neighbors, there's definitely a lot of connections that could be made. Millie and the work that you all are doing in Kerrville, there's a lot of connections I'm seeing with SA 2020, the United Ways and their software. So continue to utilize each other because all of you are experts and all of you can definitely make connections and help each other. So don't be afraid to reach out. And what I'll do also at the end of the day, I will go ahead and reshare the directory to make sure that all of you have each other's contact information, which I'm sure you all do because you all are on 1,000 emails together. But I'll reshare that just in case, because I feel like this is so necessary for us to continue to make these connections and do the work. We have to have partnerships and we have to come together. So just wanted to throw in my little preaching moment.
Thank you so much. I just want to say thanks again. It was great.
Awesome, awesome, awesome. If there are no more questions, thoughts, concerns, echoes, I'm gonna go ahead.
Thank you guys. This is wonderful. We really appreciate it. My team ended up they're out doing surveys. Had to leave. They had appointments already work with meeting some key contacts, and the barbers and the
Love
fish
it.
store and the guy that's selling, the food truck guy, and so we're gonna have little
Dude,
spots.
be
everywhere.
about it, Lisa. I see you. Be about it.
We are in it, man. We are so in it.
It
So
was a
bless you
pleasure.
all.
Always
Thank
here.
you.
Have a good
Take
one.
care.
Thank
Thanks,
you.
Latrina.
Bye, everybody.
Bye-bye.
Have a great afternoon.